Welcome to Grand Rounds in Urology's Advanced Practice Provider channel. It's part of our UroEdge Learning Centers. I'm Diane Newman. I'm a urology nurse practitioner, pelvic floor specialist, and I'm the Senior Editorial Director of Grand Rounds in Urology. I'm really excited today because I have an expert nurse practitioner, Julie Spencer, who is going to talk to us about menopause. She is certified nurse practitioner and she practices in urology. Welcome, Julie.
Thank you, Diane. I'm excited to be here. Today, I'm going to give a brief presentation on menopause, what every woman should know. Approximately 1.3 million women in the U.S. go through menopause each year. Yet, according to the Journal of Menopause, December 2024 edition, that surveyed about 1,000 women, 89% complained of symptoms. Yet 40% had to go 2 to 3 times to get the connection of menopause to their symptoms. And 75% of those women had to go visit their provider more than 3 times to get treated. Let's talk about some misconceptions associated with menopause. It doesn't occur at the same age for every woman. There are many different factors that affect this timing, and it can start as early as age 35 and extend to age 60 years of age. Symptoms vary. It's not just about hot flashes, as we often hear. There are nearly 70 documented symptoms associated with menopause: sleep issues, brain fog, anxiety, mood swings, irregular menses, joint pain, dry skin, weight gain, painful intercourse, vaginal dryness are all symptoms of menopause as well. And I could go on and on here. Weight loss at this age is not only about diet and exercise. Due to significant decreases in estrogen, testosterone, and progesterone, this can lead to a rise in blood pressure as well as cholesterol levels, as well as insulin resistance, which can affect the blood sugar in the body, which we're going to talk a little bit more about in a moment. But it's not just about diet and exercise, it's about hormones as well. Hormone replacement therapy is not as dangerous as we've been led to believe. It is helpful in managing common symptoms such as hot flashes, anxiety, among many other symptoms. It also has been shown to protect the brain, heart, and gut. Now, let's talk about the influence of gut health on menopause. A healthy gut is important for many reasons during this stage of life. The gut microbiome shifts with decreased estrogen, affecting the gut lining, which can lead to what's called leaky gut or intestinal impermeability. Permeability that allows imbalance for the gut or dysbiosis, leading to an increased risk for inflammation within the body, which creates more risk for symptoms during menopause. A healthy gut, supported through the gut brain axis, supports a hormone metabolism, specifically estrogen and cortisol levels, reducing mood swings, anxiety, and depression. It also helps regulation with serotonin and dopamine, which are produced in the gut. A healthy gut microbiome can also aid in metabolism, reduce insulin resistance, and help manage weight gain during menopause. And that supports levels of cholesterol and blood pressure. It also helps regulate insulin resistance, which helps manage weight gain. Insulin resistance caused by increased leaky gut increases during perimenopause, and it makes the blood sugar regulation much more difficult to manage. And this in turn leads to glucose uptake in the brain, which reduces mental clarity and ability to focus. Higher cortisol levels, which increases inflammation and can create sleep issues, are often affected by an unhealthy gut. More sugar cravings can lead to weight gain and increase of oxidative stress, which can also lead to increase of visceral fat, which is common during this stage of life. It also helps with digestion comfort, which reduces GI symptoms, which helps manage bloating, indigestion, and constipation, which we all know in urology world can reduce the risk of UTIs when you manage a healthy gut. Often overlooked, but its impact is undeniable. During this stage of life, nurturing a healthy gut can help prevent symptoms, improve mental health, and support a woman's overall well being. As I like to say, it all begins in the gut. Next, let's talk about management. It's really not a one size fits all approach. It's a stage of life where the woman should eat, move, and rest with intention. It's important to focus on sleep, at least 7 to 8 hours a night, proper rest, weight training to decrease risk of osteoporosis, increase their protein intake, ideally somewhere between 80 to 100 grams of protein a day, and focus on eating whole foods, fiber rich foods, as well as foods that decrease risk for inflammation. Mind body connection and stress management to higher cortisol levels mean higher risk for inflammation within the body. So, focusing on breath work, mindfulness, and somatic yoga is often recommended. Hormone replacement options. It's important to know that there are many different options out there, that bioidentical hormone replacement is safe and offered in many different forms, whether a patch, a pill, or a cream. And then there's non hormonal options that help to manage anxiety as well as hot flashes. There's Paxil, which is FDA approved, as well as Veoza, as well as several other SSRIs that providers often use. There are also vaginal creams and moisturizers that help reduce the risk of infections during this time and help with painful intercourse. There's also daily supplements that can be recommended, whether magnesium, omega-3, vitamin D with K, and B complex are my favorites. So, menopause is not the decline. It's important to view menopause as a launchpad, not as a limitation. Understanding the options available to help manage and even alleviate symptoms is key. It's important to empower and educate women to help them know their options and to encourage them to learn how to optimize their health during menopause and beyond. As I like to say, thriving, not just surviving, should be the goal during this stage of life.
Thank you so much, Julie. It's so true what you're saying. I mean, and the data supports it, the fact that this is just not identified in women, is it? During those
Oh,
menopausal years. And it's interesting that in urology, I can't tell you how many women, when they would come to me, in their mid-50s and have increased urgency frequency, and they would fear, maybe incontinence, even though they may not have had incontinence. And when I did a pelvic exam, they had atrophy, which is now called genital urinary syndrome in menopause. It's one of the signs. And, some of them had just seen a gynecologist and this was never picked up. And, and I'm not even talking about all the other symptoms that you discussed that women just kind of live with, right?
yes, yes. I see so much DSM in my practice, and I see a lot of women with recurrent bladder infections and painful intercourse to the point where they just say, "Oh, I don't do that anymore." And my question is, do you want to? Is it how comfortable is it? And we assess whether it's a pelvic floor issue or whether it's as simple as dryness, and then they're commonly afraid because they're miseducated about vaginal estrogen cream. So I spend several minutes talking with them, and I have a handout I grab for every single patient that shows them the pea size amount and exactly where to put it. And we talk about use of the applicator versus not, and their comfort level and whether they really need that much estrogen. Uh,
I've had several women, like you're saying, is once you start them on transvaginal estrogen, they're like, can't believe how their symptoms have improved. I
mhm.
mean, it's so true what you're saying. And it's, some women find the cream messy in that, but there's also, like you say, pills, or you can have the estering, which is a ring that goes in the vagina, emits estrogen over 3 months. But Julie, I have to tell our audience that why I asked you to do this is I saw your advertisement that you had a TV interview. Tell us a little bit about that.
Well, it's it's a funny story. I have two 11-year-old boys, and there is a service organization locally to where I live, and I'm interested in getting them involved in that service organization, which is a group for boys and their moms. And I gave a menopause talk at to the moms of the group, not to the boys. In that group happened to be a producer of Great Day Washington for the DC area, and so she asked me because it's such an important topic that I think is being seen more in the headlines now, but it's so commonly ignored in the past that I was super excited to go on TV and to talk about the similar topics that I just presented because it's so important that women are empowered and encouraged to seek treatment. And it's something I am very passionate about. I spend a lot of time in my urology practice encouraging my female patients to seek treatment, to not think it's normal, and to understand that they don't need to be afraid of hormone replacement, whether it's available to them and it's appropriate for them, or there are other options to help them be more comfortable and thrive during this stage of life.
Yeah, I agree with you 100%. And it was really exciting to watch that interview because I was able to do that. I think I found it on LinkedIn. And the thing is to see that, hey, as a nurse practitioner, a very knowledgeable one, imparting that information. And you're right. It seems like right now in the lay literature, but also in medical literature, menopause is getting like a resurgence, isn't it? Like the AUA, SUFU just came out with new guidelines on genital urinary syndrome and menopause, which is really nice to see. So I think we have to recognize this, but it's really fascinating that we're dealing with this in urology because of the urinary symptoms when the whole host of other symptoms that women may have really isn't being addressed. And I think that's really sad, but maybe we'll see a resurgence of some interest in this area.
Yeah, that's my hope.
Well, thank you very much. We really appreciate this. Is going to be extremely informative to our audience.
Great. Thank you for having me today.